we are going to start. I leave you with Walid, our CEO, and she's going to do a little introduction about this webinar. So I leave you with him. Thanks.
Thank you, Elia, for your presentation. I would like to welcome you to our new webinar about Pressensa Peeling. I know that because of the difference of time, the hour from here to the four continental, that we have customers from South America, from Asia, from Europe, from Middle East. So welcome and thank you for all of you to join us today. I would like to talk about the argumentation of Pressensa Peeling. We in Pressensa at the beginning, we have focused our investigation in the creation of peeling line that are different from the concept of one bottle, one acid. Because what we thought that the needing of the cosmetic market was exactly to cover the peeling requirement of having a good peeling to treat the different pathologies that the skin have. That's why we focused on the combination of the selection of the best hydroxide acid, alpha and beta, and to get on the need to have a full range of peeling to treat superficial, medium, and deep peeling. In this case, we make the difference between our brand and the other to go directly to the kind of acid that I mean every professional like you need it in the clinic, in his center, in his aesthetic clinic. As you know, peeling is used to treat various lesions that occurs for different reasons, such as moderate or acne scar, blemishes, wrinkle, solar keratosis, or facial linkages. Our selection of the best alpha hydroxide acid, for example, in the case of Renova Peel or Renova Peel, aimed to give the solution for treating the skin with controlled exfoliation process. We believe that peeling as a process for generate the new tissue on the face, especially on the body, in the case of the body treatment, have to be controlled and safety and give the effectiveness result. This combination make us going through the best of the best selection, to be frankly, not because of we are talking about the Pressensa product, but to be frankly, we choose, for example, the combination between mandelic acid, kojic acid, and TCA in case of Luminosa. And after the good result of treating the medium peeling, with that we go to investigate more concentration of TCA in case of Luminosa Strong. All of that have begun with our Effectiva method peeling. That's why we believe in controlled peeling. We don't want to use phenol, for example, to make a dangerous situation between the professional and the patient. That's why we think about safety peeling at the same time to treat different layers of the derma. That's what we focused on, and in this moment we got this full line of peeling We have 3 bottles, for example, four bottles, 2 vials and 2 bottles with more than 20 different acids mixed together. But this acid have been made in the way that we got the different type of exfoliation process. I don't want to take more of your time about this theoric part. I want to go ahead with the most important thing. I would like to present Dr. Ekaterina Lika, one of the best dermatologists, doctor that Pressensa have never been in contact with. She is a specialist in dermatology and the aesthetic field. I think a lot of you know her or have been in touch with her several times because she is always our medical director. At the same time, she owns Leader Beauty for distribution in Moldova, Romania. She is a literature and speaker in different dermatologist aesthetic congresses. She was the best the cosmetologist of the year in April 2016, in March 2018. She is the best one who can talk about the best way for protocols of peeling, and I will leave you with her. No need to talk more about that. And I don't know if she hear me, Dr. Lika, you hear me?
Yes, Walid, thank you for this great presentation. And I'm here, so we can start. Yes.
Yes, you can start when you want, yes. Dear Katia.
All with you.
Okay, so we can start the presentation. Yes. Yes. Okay. So today we will talk about Pressensa peelings, and I want to why I love Pressensa peelings, because we really have we can say 4 products, as Mr. Walid explained, but with these 4 peeling products, we can do really different types of peelings, from superficial peeling. You know that on the presentation you can see the epidermis. So superficial peelings are the peelings when we work with the corneum, stratum corneum of the epidermis. So for this reason we use Renova Peel and Renova Peel. Now, if we want to go deeper to the live cells of epidermis, we go till the stratum granulosum, and then we use peeling medium superficial, and in this case we can use Renova and Renova in combination with Dermapen. This is also a good solution that we can do these superficial peelings not only like classic protocols, but also with the Dermapen. When we use 0.25, we have the effect of medium superficial peeling. And if we go deeper, if we use Dermapen of 0.4 millimeters, in this case, we can arrive till the stratum spinosum, and then we will have the effect of medium deep peel. This is one possibility, and another possibility to do medium superficial peeling is to use Luminosa TCA with 12% of trichloroacetic acid, and medium deep peel with Luminosa TCA Strong with 25% of TCA in combination with 𝐜𝐻𝐿𝐼 and mandelic acid. During my presentation on the models, I will explain the composition and everything. I want this seminar to be more practical, but very quickly, just for you to see the composition. Renova Peel has citric, tartaric, mandelic, pyruvic acid. Renova Peel, glycolic, citric, lactic, and panthenol. But these two peelings have pH 3.5. That's why these peelings are superficial, so they do not, they are absolutely not aggressive. And if we do classic protocols, we have no exfoliation, and we can really use these products all year round. We do not have the probability of hyperpigmentation after this peeling. We really can treat pigmentation with this peeling in combination with the depigment with solutions for whitening. But if we want to use to have more deeper result, the result of medium peeling, but without very visible exfoliation, we can use them in combination with the Dermapen. So I will show you today the protocol with these two peelings together with the Dermapen. Another peeling is Luminosa TCA. So this product contains trichloroacetic acid 12%, mandelic, and 𝐜𝐻𝐿𝐼 acid. It provides little exfoliation, and it depends on how many layers we apply. So we have a great result of rejuvenation, acne treatment, pore size, shrinking, anti-wrinkle, but in the same time, absolutely no aggressive effect, and we can use it also practically all year round. And another more deeper peeling is Luminosa Strong. So this product contains trichloroacetic acid 25% and also 𝐜𝐻𝐿𝐼 and mandelic acid. Has very good rejuvenation, hyperpigmentation treatment, acne treatment, post-acne scars treatment. But in this case, we will have an exfoliation, and also it depends of how many layers we will apply. So today we will do two models. On one patient where I will do Renova and Renova with the Dermapen, and another treatment we will do with Luminosa Strong. So we will do two protocols, but the really magic thing, and why I love to work with Pressensa Peeling, that only with the really four products, we can do more than 20 protocols for different patients, for different types of skin, for face, for body, because we can use it also to treat stretch marks, flaky skin, and so on. So, but of course, we combine them with different Pressensa concentrates or vials that contain cocktails with the effect we need to obtain. So if you want to receive these protocols, you will leave your email or mobile phone in the message, and we will send to all of you this all the protocols about peelings. So we with these peelings we have great effects of rejuvenation, anti-wrinkle, acne, and so on. We will discuss it later. Just here, I want to show you some results on my patients. So after these treatments, we can really have a visible result and very quickly result. So after 1-2 treatment, we really see the very great effects and rejuvenation and and acne and hyperpigmentation, pore size, post-acne scars treatment, and so on. So you can see how the protocol look like. So in this protocol, everything is explained, what you need to apply, how many milliliters, and so on. And it will be very easy for you to work with this peeling. So you can see also the result after TCA Strong, were great, and some scars and pigmentation. And I want to say also about a few words about great product that we use after each treatment, especially after Luminosa Classic, Luminosa TCA, and if we combine Renova, Režova, and Microneedling, the Derma Repair solution. So this product really stimulates the regeneration of the skin after treatment, and it helps to regenerate very quickly. So we in 2, 3, 4 days, we can really have a great result and no side effects. So it has 𝐌𝐿𝐼𝐿 montana, centella asiatica, malva, panthenol, hyaluronic acid. And of course, the cream, without this cream, we can't do any type of Pressensa peeling. This is sun protection cream with SPF 80. So if you recommend this cream to the patient after the peeling, you will never have hyperpigmentation, and it also hydrates the skin, and it has also anti-irritation effect. So the patient can apply this even after really deep peeling. I also want to invite you to my academy, 𝐸𝐵𝐾𝐻.doctor. So you can enter this website, and you can see different courses about microneedling, peeling, beauty equipment, mesotherapy. In 1 month, it will be also a course for fillers for doctors. So you need to register at this academy, and after you will have the possibility to take these courses, and you will also have now the discount for few days after this webinar to all the courses if you will want to take them. And you will receive not only knowledge and practice about how to use all the Pressensa products, but also you will receive the certificate international that is signed by me, and also by Mr. Walid, European certificate, and also you will have the possibility to create your own web page, and with the possibility to online appointment. It will be more easy to work with your clients and your patients. Okay, so let's start the treatment. We have our model here. So we will do now the protocol with Renova, Režova, and Dermapen. So we will start. Okay, so we start the treatment with the makeup removal. To remove the makeup, we use deep pure milk. This milk is a fantastic product to clean the skin, to remove makeup, and has absolutely no, do not provoke any allergy. And you can use it for all skin types, even sensitive skin. and you will never have dryness, irritation. And we can recommend also, especially this milk for the patient after peelings at home, because we have also small size home use products. And especially this milk is great that it do not have the effect of dryness, do not provoke dryness for the skin. And that's why we will have this great effect. Okay. After, so we clean the skin with the milk. After, with the tonic, fresh hydratonic. Also a great product with the panthenol, aloe vera, that hydrates the skin and also is suitable for all types of skin, even for sensitive one. And it is great also after the peeling, when your patient has exfoliation, not to irritate the skin also at home. We recommend these two products, but we have small sizes. These small sizes of the products to recommend at home. Okay, so the skin is now prepared. Okay. Now I take Renova Peel. This peeling contains lactic acid, salicylic acid, 14%, and also mandelic acid. And it comes in a solution. So this is a liquid solution peeling. And we take about 10 puffs, and we apply this product on the skin. Because it has resorcinol, salicylic acid, and lactic acid, this peeling is great for oily skin, for to improve the skin quality, to shrink the pore size, and also has a great anti-inflammatory effect. And that's why we can. Yes?
We have a question. Have you applied a topical anesthesia to the patient, or is not necessary?
If we do peeling with microneedling, yes, it is possible to apply topical anesthesia before the treatment if the patient is very sensitive. But because we do not use a very long needle, so we will use the needle of 0.25 millimeters. So that's why it will be not so painful. That's why I didn't apply some anesthesia, but for sensitive patient, it is possible. Really, it is possible. If you want, you can apply it 15 minutes before the treatment, and after clean the face and start the treatment protocol. Okay. Now we wait a few seconds, and after we will work with the Dermapen, and after we will apply the product Renova Peel 1B. But this is like not standard protocol. The standard protocol is when we, after Renova Peel, we apply directly on the skin Renova Peel, and after we have neutralization product and calming product. So this is like standard protocol. In this case, if you use these two peelings, one after one without microneedling, in this case case, it will be like effect of superficial peeling, but with the action like deeper, because it penetrates the active substances, penetrate deep, but in the same time, we absolutely do not have any exfoliation. But if we combine it with Dermapen, we can have some irritation more. But now we will talk, I want to show you the more active protocol. Okay, so I will take the needle. Needle has 24 micro needles, and I take the length, needle length is 0.25 millimeters, so it is absolutely not long, very superficial, and we just want to stimulate the penetration of the peeling, but we never use very long needle like when we work with the for example, classic microneedling, because when we work with the classic microneedling with different cocktails for rejuvenation, for hydration, for lifting, and so on, we use microneedling. Needle length can be 0.4, 0.5, 0.6 millimeters. But in the case, if we combine with peeling, of course, we don't need very aggressive. So it's absolutely enough 0.25 millimeters to stimulate the penetration of the peeling, because the patient will feel also quite good, and we don't need to make trauma for the skin too much. Okay, so I go with microneedling. One pass. So normally when we do classic microneedling like mesotherapy, we go 2-3 passes on one part of the skin. We can do also, we can rotate and circular movements. But in the case, if we combine with peeling, we do not need this. So it is enough these stump movements just to have this micro trauma and to stimulate the penetration of the active product. Okay, so half of the face is ready. It is also very good to combine. Why we combine microneedling with peeling? Yes, we can do only peeling and we can have also a good result, but we know that microneedling has this stimulates the collagen synthesis, and we will have like double action. So if we combine this peeling with microneedling, Renova Režova, we can combine the effect with the with laser. So really the same effect like laser treatments or laser rejuvenation, but with less aggressive and less trauma. Okay, so we see that the skin is a little red now. We have some redness, but it is okay. Now we can apply the peeling. We can work also for neck. We can work the same for the body. For example, if we have stretch marks, or we have flaky skin after childbirth, after pregnancy, after weight loss. So we really can improve the quality of the skin if we combine peeling and and microneedling. Okay, and now after I worked with Dermapen, I apply Renova Peel. This peeling has glycolic acid, 44%, lactic acid, panthenol, and mandelic acid, and also citric acid. So, why we really can apply? Because pH of this peeling is 3.5, so this is not aggressive, and that's why it is possible to apply it after microneedling. Of course, Luminosa we will not apply after microneedling. This product has it comes like a gel, not like a solution like Renova Peel, and we can apply it with the fingers on the face, and the patient feels it hurts. Yeah? How do you feel? It's okay. It hurts. Normally it hurts, but it is possible to resist. So absolutely.
Sorry, Dr. Lika.
Yes, I can.
You hear me. We have another question. So, with which other cosmetic devices can be applied a peeling? For example, like ultrasonic device or something like this.
Yes, if we want to combine with another devices, we can do this. So we can do with ultrasonic if we can combine it with for example, in order to clean the skin after peeling, we can use ultrasonic to clean it, to extract the pores. And also we can do, for example, microcurrent to use to stimulate the penetration of the active peeling, but this we will do after we neutralize it and after we apply a 𝐸𝐵𝑇𝐶 product, and after we can work with the device so to stimulate the penetration of the product. Also, it is possible to use radio frequency, but also after we apply a cream. So we neutralize the peeling, we apply calming solution like a 𝐸𝐵𝑇𝐶, and after, for example, we can apply white extreme cream and with the whitening effect, and on this cream we can work with for example, radio frequency. So it is really possible to combine it with different devices. We have in Lika Doctor Academy, we have a course, beauty equipment, and there you can see also different possibilities how we can combine Pressensa products with different equipment. Okay, so I applied this Renova Peel for, we wait usually from 5 till 12 minutes, depending on the patient's face, on the patient's skin, if the skin is more sensitive or less sensitive, more thin or more thick, so the time can be different. And after we will make a neutralization, so I will change the gloves.
Okay, Alexandra asked us how much of the Renova did you use? How quantity of Renova have you applied, more or less?
Yes, we apply usually 1 ml of Renova Peel and 1 ml of Renova. How to understand 1 milliliter? So 10 puffs. So you make puff, 10. And after the same you can do with this product 10 times to push, and this is like 1 milliliter And so, and also it's very good, has the good price, because here we have 50 milliliters. So really we can use for minimum 30 treatments, because sometimes maybe you will apply on the neck and décolleté. So that's why you can, maybe you will use 2 and 2 milliliters, but minimum for 30 treatments each product. So now what I'm doing now, now we will neutralize the peeling, because this Renova Peel has glycolic acid, and you know that glycolic acid must be neutralized. In this case, we apply Pressensa Peel, which has bicarbonate that has a neutralizing effect. Also 10 times I press, and it has also panthenol and aloe vera. It has very good neutralization effect.
Sorry, Katia, Rola asked us for bikini area, what product we use for brightening?
For bikini area, for brightening, we can do this peeling, we can do this protocol for intimate area, but after neutralization of the peeling, we will apply depigment product. So this, or it is also possible to use whiteness or brightness, because we have this product we have in vials of 10 milliliters. So, or you take 2 milliliters whiteness or brightness with glutathione and vitamin C, or you use this vial depigment. So this is also possible, and you apply on the intimate area, and after this white extreme cream, and the patient uses this cream at home for whitening effect. So let us now the patient put page чуть-чуть. Now when we neutralize, for 20-30 seconds, the patient feels more pain. It's like it hurts, but it will take only 20-30 minutes. So it hurts not so long time. And usually appears like redness, some redness can appear. This is also good sign, because we know that we improve microcirculation, and that's why we will have great effect for anti-age, anti-wrinkle, hydration, and also for if we have, for example, scars, also we will have great result. So now, after we neutralize the, so after 20-30 minutes, the patient feels better. So now it do not hurt. And after we can apply one of the serum or from Pressensa, depending on the patient skin type. We can use, for example, yes.
We have another question. So how many sessions can we do, and duration between sessions? So how many time have to pass between sessions?
Yes, if we do classic peeling, classic protocol of Renova without for example, microneedling. In this case, we can do the sessions once in 7 days. But if we combine peeling with microneedling with Dermapen, in this case, we do the treatment once in 2 weeks. And totally about from 3 to 5 treatments. Okay, so now I will apply a product Revitales. This is one cocktail that contains hyaluronic acid, DMAE, organic silicone, ADN that has hydration effect and also lifting effect. So mannitol, sorbitol that also hydrates the skin and has combination lifting and deep hydration. So we take 1 ml of Revitales product. Normally it has 10 ml in 1 vial. So we take only 1 ml and then apply to the patient's skin to improve, to enrich the protocol, to have better result. We can do it without this cocktail. We can directly apply the, for example, mask, but it is better to apply this. Or if the patient has, for example, hyperpigmentation, we will apply the pigment. If the patient has acne, post-acne scars, we will apply acne heal product. If we need lifting effect, we can apply lifter essence. If we have couperose or rosacea, we will apply vitamin C. So all these protocols, all these possibilities you will see in our protocol. So this that's why I say that it is possible to with only 4 peeling products, we can do more than 20 different protocols depending on the patient skin. So I apply Revitales product. I do not, you observed that the peeling is not rinsed out. So we apply layer by layer, and after each layer, the product penetrates deeper and deeper, but in the same time, the superficial layer of the skin remains untouched, so no trauma to the skin, and that's why we will not have a very rehabilitation effect. So we will not have trauma, but we will have great result, that visible, really visible hydration, anti-wrinkle, and the skin will be very uniform. Good. And now, after I applied the serum, Revitales, I will apply a mask with vitamin C. This mask contains hyaluronic acid, collagen, elastin, amino acids, and also vitamin C. So this is a great product that really calms down any irritation. This is like I call it sauce mask. So any irritation, redness, exfoliation, dermatitis, you apply this mask, and in 30 seconds, 30 minutes, the patient feels much better. So the redness disappears, and you can use it after microneedling, you can use it after classical mesotherapy, you can use it after cleaning of the face. So and also for hydration, because it has an hyaluronic acid and collagen, elastin, and we can recommend also this mask for home use, because we have it in home use line of 50 milliliters. And in this case, the patient can use this mask, for example, 2 times per week for if she applies, for example, a thick layer of the mask 2 times per week for 30 minutes. But it is also possible to apply this mask in the evening, for all the night. But in this case, we need to apply and to recommend a thin layer of this mask. Okay, so I applied the mask, and we leave this mask for about 20 minutes. If now the patient feels has some sensation of it hurts a little, but after 15 minutes, the skin will be absolutely calm. So no other sensation, and the patient really feels that mask works very quickly and has great effect. Okay, so now we will leave the patient for 15 minutes with this mask. After this, the mask will be rinsed off, and we will apply after the treatment cream with the SPF with sun protection 80 plus, and at home we will recommend for the patient after the peeling to use Derma Repair serum. Derma Repair serum, to use it in the morning after to apply sun protection cream, and in the evening also to use after cleaning Derma Repair, and after or white extreme, or for example Supreme Effect cream that we have from home use line. But now we will ask the patient to go to another room, and we will invite another patient for Luminosa Strong peeling. And now, till we make this movement, Elia, if we have questions, I'm here to respond.
Okay, Katia, yes, we have a few more questions. So someone asked us, how about the LED therapy? It's okay to use after the treatment?
Sorry, can you repeat the question?
Yes, how about LED therapy? It's okay to use after the treatment? So after the treatment, can we use LED therapy? I think
LED
she means
therapy,
the
yes.
LED lamp.
LED lamp, yes, yes. Now I understood. Yes, of course, a LED lamp is great to combine with the peeling. I also work with it, and we use it in our clinic, this LED lamp, because we can use together with different light. We can use it with red light in case if we want to stimulate regeneration. So when we apply the peeling, this, for example, after we apply Renova Peel and leave this Renova Peel, for example, for 10 minutes, we can apply this red light with to stimulate the regeneration. In case, for example, if we have acne, if we have active acne, we can use Renova Peel in, or also Luminosa Classic in combination with the blue light, with the 420 nanometers that kills the Propionibacterium acne, this blue light, and that's why it treats or has a great effect for treating acne. We can use in combination with green light in case if we want whitening effect, depigment. So when after peeling, for example, we apply depigment solution, this vial, and we leave LED lamp with the green light for whitening. And also we can use yellow light. Yellow light is for cuperoles, for sensitive skin, and for redness. So of course I recommend combination, because we will have better effect and we will need less treatments. So if we combine peeling with LED light, I can say that we will need 1 or 2 treatment less. We will have the same effect, but with less treatment, number of treatments.
Another one more. From
Yes?
what age should a peeling treatment be done? So from how many years have you to come do a peeling?
To apply peeling. About age, we can use and we can apply it for different age, depending on the protocol that we use and depending on the patient product. For example, if we have a young patient with acne, we can use peeling, for example, Renova Peel in combination with LED lamp, and with after, for example, we apply this acne heal serum. I do not have it here. Acne heal serum, and after we apply, for example, astringent mask to treat oily and acne skin. In this case, we can use at 16 years old and 70, no problem with this. But in this case, we use Renova Peel, absolutely not aggressive, even on the young skin. If we have, for example, post-acne scars also at 17, 18 years, no problem. We can use in combination with the Dermapen. We can use microneedling and peeling. We can use Luminosa, but we use in combination with the serum, for example, this acne heal serum that is special for young skin. If you have skin sensitive with cuperosis, you can use, for example, Renova Peel with the vitamin C serum. It comes in this vial, and also you can use it for young patients to calm down the redness and to improve the to prevent the appearance of wrinkles. But and also we can use it at 30s, at 40s, 50s. So it just depending on the protocol that we use. So after peeling, if we, for example, apply firmness solution, that it is for skin usually after 40, 45, in this case, we will have great effect. But especially peeling do not have problem with the age.
And Katia, Alexandra asked us, when should we use aseptic cool?
Yes, aseptic cool we use after Balance Peel. So in this, at our first patient, I didn't use the Balance Peel because I used together with Dermapen. So after Dermapen, it will hurt. So in this case, we take it off from the protocol. But if we use, for example, standard protocol of Renova, Renova, then after we neutralize with Balance Peel, and after 2 minutes, we apply aseptic cool. And we have calming, but at first application, first minute, the skin can be red after application of aseptic cool, but this is a good part that we stimulate the microcirculation, and we will have a great effect of rejuvenation, and also it helps for post-acne signs. And after 4 minutes, we can apply one of the Pressensa cocktails. So we usually apply aseptic cool in this protocol only if we do not use Dermapen. If we use Dermapen, in this case, we do not apply aseptic cool. So these protocols we have explained, and it is very easy to use them. Okay, we have more questions, or we start with the second patient, Elia?
Okay, Katia. Rahat, sorry if I don't say in the correct way your names, but it's a little difficult for me. So Rahat asked us if we use Dermapen in the underarm speed if it's dark. So I think he means by this zone, can we apply the peeling with Dermapen if it's dark?
Yeah, if we have hyperpigmentation and dark skin, yes. In this case, we need to work. We can apply, but if the patient uses some protection cream, but first, better for darker skin to do few treatments without Dermapen to prepare the skin, and only like third treatment it can be with Dermapen. Never for more for phototype, for example 5, 6, never use peeling with Dermapen for the first treatment. You need to see how the skin reacts. You need to know your patient and to prepare the skin. And after, yes, it is possible, but also with a short needle with the 0.25 millimeter.
Okay, so if you want, you can go to the second patient.
Now
and when you finish, I ask you all the questions we have.
Yes.
Okay.
Okay. So now we have the second patient, and we planned to do Luminosa TCA Strong Peel. But now I see, looking on the skin, I say that I will work better with the Luminosa Classic, because I see we have some irritation, we have some post-acne scars, and the skin is more sensitive. And in this case, Luminosa Strong is not recommended. So I plan to do this, but I will not do. And this is normal. So you always look at your patient's skin. And if you see that, for example, like in this case, we have some post-acne, but also we have some like irritation on the skin, no exfoliation. Yes, but in this case, better not to use Luminosa Strong today. We can start with the Luminosa TCA Classic to use TCA 12%, not to use 25 at this moment. To apply, we will apply 2 layers. We will have exfoliation after this treatment. We will treat also some acne, little acne, but it's not contraindicated because we do not have a heavy grade of acne. And when the skin will be prepared after, for example, 2 treatments of Luminosa TCA Classic, we will have the possibility to apply Luminosa Strong. So in this, and the same, if the patient comes to you and you see that the peeling is, even if the patient says, I want this deeper peel, if you see that the patient has contraindication now at this moment, you will never do this. So the everything depends on the patient's skin. So let us do the protocol of Luminosa Classic. So in this case, how we start? Also, we start with the cleaning of the face. We do not have makeup here, but we just want to clean the skin with the milk, deep pure milk. After we apply tonic. But if we want to do Luminosa TCA, we always need to look at the patient's skin if the patient do not have any exfoliation. Yes, here the skin is sensitive. Here we have like predisposition to redness, like couperose and like rosacea. But Luminosa Classic in this case is not contraindicated. And this is great part because especially in Pressensa, this trichloroacetic acid is fixed, and that's why it do not has the a possibility to penetrate too deep and to have this aggressive effect. So we will have here great effect of anti-inflammation, to shrink the pore size and to improve the quality of the skin. Michaela, take please the picture before the treatment and after in the group, or we will post, and we will post and you will see the result after the treatment. Yes, and make from one side and from another side. And you will see that even after peeling, the skin will look better than now. So even if it is a trichloroacetic peeling, we know that TCA peel is more aggressive, but this is not in case of Pressensa. The great result, but no, absolutely no aggressive. Okay, now I clean with the tonic. Michaela, wash this. Okay. So now I apply fresh hydratonic for also to hydrate the skin. Okay, super. Also, we have different protocols when we use Luminosa TCA. It is possible after cleaning the face to apply, for example, exfoliate product. This product contains fruit acids and glycolic acid and niacinamide, so to stimulate the penetration of the TCA deeper and to have anti-inflammatory effect because of niacinamide. This is a great product that we use also before cleaning. We can apply it for 10 minutes and after to work with ultrasound. But in this case, if we have more sensitive skin, we will not use it and we will apply directly Luminosa. If the patient also has acne, we can apply Renova Peel before, so we can apply 1 milliliter of Renova to wait for 2 minutes and then to apply Luminosa TCA. But in this case, for more sensitive skin, I will not use another products to prepare. I will start directly from application of Luminosa TCA. So I take with the syringe 1 milliliter of the product. 1 milliliter is enough to apply till 2 layers. Really, it's enough for 2 layers, only 1 milliliter. Okay, and the good part is that this peeling is like a gel, not liquid, so it is very easy to work with, and you can control not to penetrate to the eyes and so on. So it is very easy to apply it uniform because it's like a liquid gel. So I take this, I took 1 milliliter. Normally the vial has 5 milliliters. So this is enough for 5 treatments. So I put it here, 1 milliliter, and I take this and I apply Luminosa on the face. First I apply first layer. So Luminosa TCA has trichloroacetic acid 12%, mandelic acid 6%, and also 𝐏𝐿𝐴𝐶 acid. 𝐏𝐿𝐴𝐶 acid, you know, that has a whitening effect, so that's why we will have great effect in treating of melasma, hyperpigmentation. We can use it not only for face, neck, and décolleté, but also we can use it for body, if we for intimate area, for axilla, and we have great effect because it has also 𝐾𝐲 acid. But the best part is that it is after this peeling, the exfoliation will appear, but it is easy exfoliation. So we will not have very big exfoliation. So for sensitive skin, it's really perfect. So now I applied first layer. How do you feel? Cum vă simțiți? Bine? Nu ustură tare? No. First layer, usually the patient do not feels a lot. So it's like a little tingling, or it hurts very little. So we need to wait about 2 minutes, and after we can apply the second layer. You know that the trichloroacetic acid has like auto neutralization properties, so we do not need to apply neutralizer after TCA peel. So we just need to wait, and it will have the effect of auto neutralization. And that's why if we want to have a better result and to stimulate penetration of the acid deeper, in this case, we apply more layers. So when we apply first layer, the patient practically do not feel any pain. Now I will apply the second layer, and now the patient will feel it more, but also not so much. So it is absolutely not difficult to resist. And if you need, you can apply even 3 layers. But now in this case, I will apply only 2 layers for the first treatment. For example, after 2 weeks, because this treatment we repeat after 2 weeks, TCA peel, I can apply for my patient 3 layers of TCA Classic. And after 2 more weeks, we can do the Luminosa TCA Strong, like the third peeling, or more deeper. But in this case, now it is not possible. Acum un pic mai tare, da? Da. Now the patient feels the sensation are more hard, it hurts a little more, but it is possible to support. So this is not so painful, absolutely. If we use Luminosa Strong with 25% of trichloroacid TCA, in this case, of course, the patient feels much pain, bigger, but we can't compare it with classic TCA peels, because TCA peel with the Pressensa, we can say that practically no pain, little, but not big, really big pain. If you used another products from another companies, you know that, for example, TCA on 25%, it really hurts, and the patient can't support this. You can apply even anesthesia. So now we see that in 2 points where I had this post-acne sign, I have a little frost. This is absolutely not a problem. This is normal for 2 layers. But usually after Luminosa Classic, we do not have frost, but that's why I didn't apply the Luminosa Strong for this patient, because even 1 layer can be too aggressive. now. So we need to do 2 times Luminosa Classic once in 2 weeks, and after we can do, for example, the Luminosa Strong. It is possible also to apply on the neck, on the décolleté. So if you saw that 1 ml of the product, 1 milliliter, is enough for 2 layers to apply on the skin. So this is great. In case if you want to apply 3 layers, or maybe you want to apply also on the neck, you can use in this case, for example, 2 milliliters of the TCA, Luminosa TCA. Okay. Cum sunteți? Da. Un pic are nasul. Da. So the patient feels now better, not so much like it was after the second application, second layer, but only around the nose. So she feels bigger sensations, but this is absolutely not a problem. What we will apply now? Now I want to apply for the patient 𝐒𝐴CNE product. So this product is specially for acne treatment. And it improves, prevents the appearance of inflammation, prevents the appearance of follicular hyperkeratosis, and destroys Propionibacterium acne. So really great product that has a citric acid, pumpkin seed extract, and also vitamins, vitamin A, B, B5, B3, organic silicone. So really great ingredients that treat acne and prevent the appearance of new inflammatory lesions. So in this case, it is great to apply this product. So I open this vial of, it has 2 milliliters, and I will apply it now on the skin. We do not, you see that we do not rinse off the product. So we apply it directly on the skin. Now the patient will feel good, no irritation we will have. So we apply this product, and after we will apply Derma Repair and a mask. Okay, so good. How do you feel? Good? Yeah. Okay, so 𝐒𝐴CNE we can use also with the Dermapen to treat post-acne scars. So the great product for post-acne scars, but of course we can do microneedling for the patient with the inflammation. When we have only scars, in this case we can use microneedling. If we have also some inflammatory lesions, in this case we can combine only with the peeling, or we can use it in combination with different machines like ultrasound, like microcurrent to clean the skin. Okay, perfect. So I applied 𝐒𝐴CNE, and now, yes, I will apply this and mask, and we will start to talk about questions. Okay, so now the next layer is Derma Repair. So that has Arnica montana, Centella asiatica, hyaluronic acid, so that really stimulates regeneration, and that's why we will have very short rehabilitation period, and the patient usually applies this serum also every day. And after this we apply the mask, we will apply, we can apply two masks together. Why two? We have astringent mask that has anti-inflammatory effect with green coffee extract, grapefruit extract for acne to treat oily skin. But I want not only this effect, but I also want the effect for redness, to calm down the skin and to have lifting effect. In this case, we apply Comfort Sense mask that has 𝐶-collagen, elastin, and also algae extracts. So how we can apply both masks? So I take like 2 milliliters of Comfort Sense mask together with 2 milliliters of astringent mask. I mix them together and I apply on the skin. If we do not have any inflammation, we can use only Comfort Sense mask, so no problem. If but in this case, I want a better result, so that's why I apply both masks together, and we leave it for 15 minutes. Okay, so we leave this mask on the skin, for example, for 15 minutes, and then we take off, we rinse off the mask and apply sun protection cream. But if you don't want to apply the mask, you can apply only Derma Repair and after sun protection, and the patient can go home. So this is also possible. So as you like, as you prefer. It is also possible only with the Dermapen. So we leave our patient for 15 minutes and let's answer the questions. And after I can take off the mask and I will show you the result. So, Elia, I am ready to answer the questions.
Katia, yes. I'm going to ask some questions we have by the chat, but we are going to allow the participants to share the video if they want and ask to you directly, okay?
Okay.
So first, we have a question of Haya. Why we don't remove the TCA peel before applying the ampoule or serum?
Yes, the question is why we do not rinse off the TCA peel. Because TCA peel has the property, it's like auto neutralizer peel, so we really don't need to neutralize it. We just need to wait 2 minutes in case if we use Luminosa Classic, and 6-7 minutes if we use Luminosa Strong, till it will be auto neutralized. And that's why we don't need really to rinse it off. In case if we use, for example, peeling with glycolic acid like Renova, this type of acid needs to be neutralized. So that's why we apply neutralization. But in this case, we really don't need to rinse it. We leave it because this product has not only TCA acid, it has also 𝐏𝐞𝐲 acid and mandelic acid, but they are very small percent, and they do not have exfoliation effect, but they have like treating effect. So we will have the effect of treating melasma, hyperpigmentation, inflammation, oily skin. So we do not need, because we want to maintain the treatment effect from ingredients.
Okay, another one. What about darkness and elbows. It is applicable, and what is the best procedure for these cases?
Sorry, but I didn't understand the question.
Yes, it's because we have a little sound
Yes.
problem, but it's solved now. So about darkness, and I'm going to look for the question again. So can we use Luminosa Intermedium or Strong for knees and elbows?
Yes, now I understood. Yes, of course, we can use to treat knees, elbows, and axilla, and also intimate area, and also with Luminosa TCA Classic and Luminosa TCA Strong. All depends on the skin. If the patient has firm skin, usually at elbows, at knees, you can really use and Luminosa TCA Strong. So we really will not have a problem. You can apply 2 layers of this product. And after, you need to apply, for example, whiteness or brightness product with the glutathione, and the patient will have great effect for hyperpigmentation, but also it will improve the quality of the skin, and we will have the lifting effect in this area.
Okay, I'm going to allow Dr. Konul Namasova to ask you directly. Only a minute. Okay. We are doing it. So, Dr. Konul, you can ask. You have the microphone off, so now you can.
Yes. Do you see me?
Dr. Konul? Yes.
Yes, yes, doctor, I can hear you. You can ask the question, please.
Yes. Okay. Hi, I am from Azerbaijan. Please tell me about all radical peelings. Who can the exfoliant is hide exfoliant, please?
Radical. Sorry,
I think she means chemical ones like Luminosa TCA and Luminosa TCA Strong, I think.
Okay.
I didn't understood the question very well, so I can't.
Do you hear me?
Please, Dr. Konul, we are hearing you. Please, could you repeat your question?
Okay, I want to answer from the radical peelings. Who gives the exfoliant is hide exfoliant?
Yes, now I understood. Okay, so if you want more active peeling, in this case, of course, we recommend to use Luminosa TCA Strong. So if we use Luminosa TCA Classic, we can have some exfoliation, but not always, depending on the patient's skin. But if you want more active and if you want really to have exfoliation, in this case, of course, please use Luminosa TCA Strong with TCA 25%. In this case, you can apply from 1 to 3 layers, depending on the patient's skin. So even after 1 layer, you will have visible, really visible exfoliation. If you want the second layer, you wait for 5-6 minutes and apply the second layer. You will see the frost, and you will have this some crusts on the skin that you will have. And if you need deeper, after 5 more minutes, apply 1 more layer. And here you will really have really big exfoliation, more aggressive.
Okay.
Okay. We are going to give the word to Siberian Petru. Please, Siberian, you can ask. Siberian? Do you hear us? Okay, we are going to go.
Elia, maybe you will better you ask me and we talk.
Okay, so I'm going to ask the questions from the chat. So the best choice for inflamed acne and how many sessions the patient will need and the duration between each session.
Yes, in case if we have inflammatory acne, in this case we can do the protocol of Renova peeling with acne heal and in combination with the LED therapy of blue light. So we have the protocol of anti-acne blue-red peel. So in this case, we need to do about, depending on the skin, from 3 till 5 treatments. And once if we do Renova, we can do once in a week. If we combine LED therapy with Luminosa TCA Classic, in this case, we do these treatments once in 2 weeks. And we have also great results. But after peeling, we always apply acne heal solution, like I applied today, this vial acne heal. And depending on the acne, of course, sometimes we need also treatment, internal treatment, so it takes time, like a chronic disease. But big inflammation we can calm down really quickly in about 4 treatments, once in 1 week.
Okay, if the patient don't have acne, do you use another layer and don't rinse off the TCA? So you never have to neutralize the TCA peel?
Yes, TCA peel, we really don't need to neutralize. We can apply 2 layers, 3 layers, depending on the skin, and we do not need to neutralize. We can apply only, for example, Derma Repair, and after if you don't want to apply the mask, you can apply, for example, a cream. We have Total Lift or White Extreme with a whitening effect. It's like a more oily cream, and you apply this cream, and that's it. So because this acid do not need to be neutralized. But if you use glycolic acid peels, you always need to neutralize them.
Okay. Another more, can we combine the treatments with PRP, the plasma treatment?
Peelings, of course, we can combine peelings with the PRP treatment, but usually not in the same treatment. In the same treatment, for example, you can combine with the exfoliate product. For example, when you do the treatment PRP, before applying mesotherapy or microneedling with PRP, you can apply exfoliate, like pre-peeling, to prepare the skin for 2-3 minutes, then rinse it off and use PRP treatment, or injectable or with microneedling. But if you want to do, for example, classic protocol of peeling, or Renova or Luminosa Peel, you can do it 1 week apart. So today, for example, to do peeling, after 1 week to do PRP treatment, and after 1 week to do peeling, and after 1 week PRP. So once in a week.
Okay, another one. I saw doctor applies the peel around the eye. Is this safe?
Yes, because I used especially Luminosa TCA Classic. This is not Luminosa Strong, and it has only 12% of 𝐏𝐴𝐻 and 𝐜𝐵𝐻. So in this case, and if you apply 1 layer, it is absolutely safe, and you will have great effect and whitening and anti-wrinkle and firmness. Absolutely no problem. Luminosa Strong, TCA Strong, we do not apply around the eyes, but Luminosa Classic, yes, it is possible. I really recommend.
Okay, for intimate area, what is the protocol for whitening effects?
For whitening effect, we can, I like to use Luminosa TCA Classic or Luminosa TCA Strong, but always if you use Strong, not to apply on mucosa, to apply it only on the skin. So you clean the skin. After you apply Luminosa, 1 layer of peeling, you wait for 5 minutes. After you can apply the 2nd layer of peeling, or Luminosa Classic or Strong. So you can start with Classic, few treatments, and after to do Strong one. And also wait till 3 layers. You can apply till 3 layers of peeling, 5 minutes before layers. And after, to apply this white extreme cream. So this cream is especially for whitening, but it has also calming effect and anti-aging effect, and it improves the quality of the skin and also gives this whitening. So very easy. You apply few layers, apply white extremes, and the patient goes home. You can recommend this cream. We have it 50 milliliters for home use line, and the patient applies this cream every day. And it is possible also at home to combine with exfoliate. Exfoliate we also have in a small 30 milliliters home use bottle. So for example, once in a day patient can apply exfoliate, and once in a day white extreme cream. But exfoliate to start to apply at home after 3 days after peeling. So first 3 days patient applies only white extreme, and after 3 days can start exfoliate. And we repeat this intimate peeling once in 10 or 14 days.
Okay, thank you so much. What is the most important instructions we need to give to the patient after the treatment? How has the patient to take care of the skin before a peeling treatment?
Yes, before any peeling, especially if we do Luminosa TCA with the trichloroacetic acid, Luminosa Classic on Luminosa Strong, it is so important first to use the mild products or soft products for cleaning. So to use like deep pure milk, like fresh hydratonic. So this not to have this soap, not to contain soap, and not to contain alcohol. this cleaning solution everyday makeup removers, because if we use these solutions with soap, we can have dryness on the skin. This is not good. First, second one, to apply Derma Repair, to apply a product that stimulates regeneration of the skin every day, 2 times per day, and of course sun protection. So I will show you one more time. So this is Derma Repair that the patient applies, and sun protection. Sun protection every 6 hours. So depending where you live, and if the sun is very active, in this case, every even 4 hours if you have now summer, for example. And of course, not to go to the sauna, solar, and not to go to the beach for about 1 week after treatment, and always to apply sun protection, and then we will never have any irritation. In general, you know, this is a great cream that has also hydration effect and protects very good from any side effects.
Okay, thank you so much. Another question from Haya, Renova and Renova are safe for pregnant?
Very good question from Haya. Just to, yes, 2 products, Renova and Renova, if they are safe for pregnant women. Renova is not safe, so we do not recommend Renova for pregnant women. But Renova Peel is absolutely safe. So this product you can really use for pregnant women who want, for example, to have like Hydra Peel. We have a protocol of Hydra Peel, hydration peeling, that has the effect of hydration, improves the quality of the skin, and also has whitening effect. When after this, we just leave it on the skin, not till 12 minutes, but we apply it only for 5 minutes. Then we neutralize it. Then we apply aseptic cool. After we apply serum with vitamin C and vitamin C mask. So this protocol, 𝐏𝐿 treatment or Hydra Peel, is absolutely safe for pregnant women.
Thanks. Can we use Renova around the eye with Dermapen?
Renova Peel, we don't need to use around the eye with Dermapen. In case if you want to do Dermapen for the area around the eyes, it is better to use Active Eye product that is especially formulated as exclusive formula for skin around the eyes, that improves and the color of the skin and the quality, and prevents the appearance of dark circles and puffy eyelids, and prevents the appearance of eye bags. So better to use together with Dermapen Active Eye product, but not Renova Peel.
Okay, what about patients on blood thinners?
On what, Elia, sorry?
Blood thinners. I don't understand the question very well, but I don't know if she wants to say maybe anemia, maybe?
Well, safe for pregnant, blood thinners. Yes, now I understood. Yes, this means if the patient take some blood thinners like aspirin or so on, this is absolutely no problem when we do peelings, and when we do microneedling, especially if we use small needle or till 0.506 millimeters, this is absolutely safe. No problem. Only when we do injectable treatments, mesotherapy, fillers, we need to prevent the patient that it is probable that we will have some hematoma after treatment. But for peelings, this is absolutely no contraindication.
Okay. What are the aspects to take in account to choose according the patient's skin, the product? What, for example, how we choose the correct peeling between Renova and Renova, or Luminosa TCA or Luminosa TCA Strong?
Of course, it depends on the patient's skin. So we have different, that's why we have these different protocols. If we have like thinner skin, if we have younger skin, we can use Renova peelings. If we want more active peeling, we want to have exfoliation after peeling, we can use Luminosa TCA Classic or Luminosa TCA Strong. There are I think it is very, now it takes time to explain all the patient, but that's why we created this, our academy. So we have the course, we have of peeling course where we have 15 protocols and where I show each protocol on 15 patients. So you can see 15 types of videos, and also the theoretical part when I explain about each type of peeling, when we apply especially this type of peeling on the depending on the patient skin and patient problem. So it's really difficult to explain now in few minutes, but this is the good part, that if we want peeling more with more superficial effect, with no exfoliation after, but with a great effect for hydration, rejuvenation, or anti-acne, we use Renova and Renova peelings. If we want more active peeling, we have, for example, more problematic skin. In this case, of course, we need to go to Luminosa peelings with TCA, TCA Classic, in case if we have more sensitive skin, and TCA Strong for more thick skin, or if the patient is prepared for bigger exfoliation. Maybe in the future we will do like webinars when we focus on one skin problem. For example, focus on acne, we can do focus on hyperpigmentation, focus on this, and then we can talk about different protocols, especially for this problem. I think like this, Elia. Okay. So I think now I will take off the mask and we will see together the result, how the patient look like after Perfect. The mask. And if you have any other questions, so we can continue with the questions. Okay.
Thank you.
Okay, so I will take off. How do you feel? Done? So now the patient says that she feels great, absolutely no pain, no other sensation, calmed skin. So that's why we can understand how great the masks work. So we used a combination of astringent and comfort sense mask, and we can see that the skin looks great, and important that the patient has no sensations bad sensation. So the patient feels that the skin is absolutely calm. So that's why it tells us that everything is okay. That if the patient do not feels any pain, any irritation, and so even if we have some redness, it will disappear quickly because the patient do not have any sensations. But now you can see that the skin looks great. It really better than it was before. Even if we did the peeling treatment, it was TCA or TCA Classic, but their skin looks perfect. Less red, more white, more uniform. So this is the magic of Luminosa TCA, that immediately after even one treatment, we have great result, and the patient sees this result, and the patient always come back because they really feel that the product works. Okay, so Michaela, you can come and take a picture, and we will show this result, and we will send you, we will post this result. This is immediately after treatment, and after now I will apply Defense Extra SPF. Of course, some redness we still have because you saw how the skin was before. We need, we will do a course of about 4 treatments, and after it will be after 2 months, we will show you really the result, how it will look the skin after a few more treatments. But now I apply the sun protection cream. This cream has hyaluronic acid, panthenol, extract the aloe vera, so absolutely no oily, no white marks. So it has very good hydration effect and prevents the appearance of hyperpigmentation, and for our patient is absolutely important because here we have skin redness, so skin cuperose. In this case, sun protection cream is also very important. So our patient needs to apply this cream every day. No matter we have winter, summer, so every morning to apply this cream. Okay, so you see, how do you feel? Good? Good. So, and this is good, that the patient feels great, even if we did TCA peel. Okay, good. Thank you. Now. Okay, so if we have any more questions, please ask me, but I think it's a lot of time, so
what we are going to do is
if we do not now, if we're not able to answer all the questions, 𝐿𝐴, you will write to me and I will reply to all the questions even after the webinar.
Thanks so much. That are we are going to do. If you have any more question or we haven't answered your question, you can ask now, and later we'll answer you by email. Okay, so I'm going to leave you, Katia, with Walid, and thank you so much, all of you, for being with us today.
Thank you, 𝐿𝐴, thank you very much.
I want to thank all of the participants with this webinar. Really was very active webinar, a lot of participants. We have a lot of questions to answer later. For sure, we will answer. We will give all of you if it is needed from you, just please email us for a certificate that you have attended this webinar. We will send it to all of you. And I want to give my thankful and to thank Dr. Lika for her wonderful hands, really, in doing this protocols. If we have excellent product, we have, but if we don't have a good protocol to use, we don't reach the result that we want. With Dr. Lika, always we got this excellent relationship between what we create together with her, and to put it in good way of practice, and that what give us as the brand, as a Pressensa brand, give us this prestige in the world, and that's why for us always, Dr. Lika, you are our diva, as we said it in here in Spain. Thank you for your time.
Violet, very much.
And I hope that together we will do also another webinar in the next future. We will tell you about it, maybe about mesotherapy. If you have idea about another webinar, specific treatment, please ask us. We are open. We love to interact with you, with all of you. And Dr. Lika and me will be happy to give everything that we have. Thank you for everything, and thank you, Dr. Lika, for everything.
Dear colleagues, also I want to thank you, Mr. Walid, Elia, for organizing this webinar. All my colleagues, for you, I felt that you are near me, so we were like all together, even if we are far away. And I really love Pressensa products. I work with these products every day for a lot of years, and I really share my own experience that if you will have any question, please ask me, and I respond always, and I hope to see you soon at the next international webinar, Pressensa.